Here in the Coumadin Clinic at LAC USC Medical Center, we offer PTT and INR monitoring. Our valued staff will be able to provide any patient teaching or diet consultations. We hope to see you soon here at LAC USC, where your heart really matters.
Welcome back to Are You Smarter Than a Student Nurse? Well, so far, Nita's gone through 10 of the 15 questions. She's almost accumulated enough points for the books, but is she going to accumulate enough points for the clinical bag? We'll find out now. Okay, Nita, the next question is, it is the nurse's responsibility to do the following when administering anticoagulants except A, question unclear and inappropriate orders, B, follow protocols to the letter, C, reconcile the patient's medications, or D, take vital signs only before administration of medications. Okay, Nita, do you have an answer for us?
I don't feel really confident in my answer, so I'm going to go ahead and copy student nurse Christine's answer.
Okay, well, it's a good thing I'm in nursing school and I'm such a great critical thinker because I get questions like these all the time. My answer was D. I'm pretty sure it's D because you don't only want to just take vital signs before administering any medications for your patients. You want to make sure you check after as well because you want to monitor the patient. And if you take the vital signs before giving an anticoagulant, you want to check the blood pressure in particular because if it's too low, you could further lower the patient's blood pressure by giving an anticoagulant.
That is correct. Okay, well, Christine, your time in the hot seat is done. Nita, pick a new student.
I think I'm going to pick Mila.
Okay, ready for the next question?
Yes, I am.
All right, here we go. The next question is, what are some of the side and adverse effects of anticoagulants that the nurse needs to be aware of that require immediate medical attention? Nita, you have an answer for us?
Actually, I don't think I know this one either, so I'm going to peek at Mila's answer.
Mila, show us your answer.
Sure. Some of the adverse effects of patients undergoing anticoagulant therapy that the nurses should know and be responsible for and notify the doctor is bleeding, dizziness, and pain in the feet. Bleeding is the #1 critical area that nurses should know because patients on anticoagulant therapy are very likely to bleed easily than normal. So make sure that you watch out for bleeding that does not stop about 10 to 15 minutes after. Also for dizziness, pain in feet, and one of the adverse effects also is for any change in the mental status.
That is correct. Good choice, Nita. All right, well, Mila, you're out of the hot seat. That was awfully fast. Nita, pick someone new.
Pick me again.
Right here. No, right here. Right
I haven't
here.
picked Lauren yet. Lauren. Yay.
Okay, Lauren, are you ready to be in the hot seat? Okay, let's go to the next category, which is the only one that is left, patient teaching. Okay, first question is, what is the commonly prescribed take-home anticoagulant, and what must a patient be instructed to do on a regular basis when they begin this therapy? Okay, Nita, do you have an answer for us?
I think I do. I'm gonna go ahead and say heparin, and then they're supposed to check their feet.
That is incorrect.
Can I do it same, please, and pass it to Lauren?
You surely can. Lauren, show us your answer.
The answer that I put was the most common take-home anticoagulant is Coumadin, and what the patient will need to do will visit the anticoagulation clinic where they will be educated and provided with written teaching materials, and they will participate in the planning of their care.
That is the correct answer. Okay, Nita, 2 questions left. Time to pick a new student for the hot seat. Lauren, you're free.
Thank you, Lauren.
Who are you going to pick?
Come on, Nita. Are we friends? Ritter. I would pick Mila. Woo, Mila! Welcome back, Mila. Yay.
Ready for being in the hot seat?
Yep.
Okay. The next question. What types of social habits should you teach your patient to avoid while on anticoagulant therapy? Nita, do you have an answer for us?
I think I do.
Okay. What is your answer?
My answer, I have 2 actually. Some of the social habits that patients on anticoagulant therapy should be aware of is their alcohol consumption, because that inhibits warfarin metabolism in the liver, and it increases the INR, leading to hemorrhagic episodes. And also, if a patient is using chewing tobacco, because that has the highest amount of vitamin K per gram of any source to be ingested.
That's correct.
Yay!
One question to go. Are you ready?
Yes, I
Okay. The last question is, what do patients need to know prior to a dentist appointment? Nita, do you have an answer for us?
It's my last question, and I think I do.
All right. Show us your answer.
I put the patients need their INR testing done 72 hours prior to dental surgeries and to use soft bristled toothbrushes before or when going to the dentist.
What do you guys think? Do you think she's right?
I think so. Yeah. Definitely.
I think so.
Nita? That answer's correct. Your points total for tonight's episode is 25. You win the full clinical bag and all the books. Congratulations. And that's it for tonight's episode of Are You Smarter Than a Student Nurse? Come back and we'll see you again next time.
Are you smarter than a student nurse? Are you smarter than a student nurse? Are you smarter than a student